like to call the meeting to order, Commissioner?
That's correct. That's right. Thank you. I appreciate your input. I'd like to call, I'm not sure. I would like to call the meeting of the Community and Public Health Committee meeting of July 20th to order, please.
And since there's just two of you, I can note that Commissioners Dorado and Christian are present. We can move on. Commissioner Dorado, would you like me to call the items? Is it okay?
Yes, please.
Okay. So item 2 is the approval of the May 18th, 2021 meeting minutes.
I move that the minutes be approved.
I second it.
And there's no one on the public comment line, and I've been advised that when there's just two commissioners that a motion and a second is enough to approve, so we can move on from that, if you're okay with that.
Great.
Item 3 is an environmental health branch update.
Great.
I'm going to share the screen, and I'm going to ask if you all can see it. When you share the screen on WebEx, it's not possible to know if it's being seen, so just let me know. I'll pull it up right now. How is that? No? Okay.
No.
How about that?
There you go. Yep.
Okay, there we go. So you may begin, Patrick.
All right. Thank you, Mark. Good afternoon, Commissioners. My name is Patrick Fosdahl, and I'm the Acting Director of the Department of Public Health's Environmental Health Branch. I've been the Acting Director since July of last year when the Director, Stephanie Cushing, retired. I've recently accepted an offer to become the Director, so I will no longer be in the Acting Director position beginning next week. The Environmental Health Branch periodically has been asked to present at these Health Commission meetings, and it's a real honor to be here this afternoon, and I'm grateful for the opportunity. Next slide, please. I want to start off by orienting you to where we are located in the Department of Public Health. We'll see circled on the slide that we are in the Population and Health Division, and I report to Dr. Susan Phillip, the Health Officer. Next slide, please. And then just by way of background, the Environmental Health Branch is the regulatory branch for the Health Department and is made up of about 30 different regulatory programs which enforce the nearly 50 different health codes in San Francisco. We have a staff of about 150 employees and an annual budget of about $25 million. And you can see all the programs and staff listed there on the slide, which reflect the size and scope of the areas that we regulate. We cover everything from hazardous materials and waste to contaminated site cleanups, housing, restaurant food safety, massage and body art, noise, water, to name just a few. And then the Children's Environmental Health Promotion Program is circled, and we're going to be highlighting that program for you this afternoon. Next slide, please. Today I'm going to start by providing an overview of the health order enforcement role that we played during the COVID emergency, and then spotlight one of our programs, the Children's Environmental Health Promotion Program. You may have heard about a very large settlement which was reached with a number of lead paint manufacturers and local cities and counties, and we want to share with you how these funds are going to be used here in San Francisco, which is very exciting because it's not every day that you get handed millions of dollars to use for a good cause. So we'll be talking about that a little later this afternoon. But to start off, next slide, please. So what was the Environmental Health Branch role during COVID? And I like to think of us as the Swiss Army knife for the health department. We filled many roles and went anywhere we were needed. To name just a few, at the beginning of the emergency, we originally deployed 12 staff to conduct incoming traveler interviews. We wrote guidance documents, we set up cleanup contracts, and provided staff training for hotels that were used for housing COVID positive patients. We had 7 staff assigned to the COVID command center, and we even sent 2 staff to Santa Cruz in response to a mutual aid request that we received last year during the fires. Having said that, as the regulatory enforcement branch for the health department, our primary role was to enforce the health orders and directives. We basically added the enforcement of the health orders and directives to the work we were already doing. An example of this is early on in the emergency, the health officer created Health Order C-1904, which set health standards for the single resident occupancy hotels or SROs. We very quickly put inspectors in the field and conducted inspections at the over 500 SROs in San Francisco. This was pre-vaccine when not much was known about COVID, and these inspectors really put themselves at risk and were among, I think, some of the unsung heroes of the COVID response. As the emergency unfolded, we recognized that there were going to be 2 main components to health order compliance. Those were prevention and enforcement. There's an old doctor saying that says an ounce of prevention is worth a pound of cure, and this also applies to health order compliance. The better job we could do at preventing violations from occurring, the better the compliance with the health orders was going to be. So we invested a lot of energy initially into education, email blasts, phone calls, site visits, conducted webinars as an investment in that ounce of prevention. You can also see the enforcement tools listed there, and we worked closely with the city attorney's office around when and how these were used. At the end of the day, these enforcement tools were applied when prevention failed. It is worth noting that businesses found to be violating the health orders were also putting their other permits at risk, not just the health department permits, but those issued by the Alcoholic Beverage Control or ABC, the Entertainment Commission, and Shared Spaces, which we coordinated with all those agencies around enforcement during the pandemic. Next slide, please. So when it comes to health order enforcement, we set up progressive enforcement steps, and this is not dissimilar from what we do every day with a number of our other regulatory programs here in environmental health. This slide presents a very basic overview of the process. The first step is being issued a notice of violation. These notices let the business owner know what violations were noted and what needed to be done in order to correct the problem. These had a very short correction time during COVID. It was typically immediate to less than 24 hours to correct. During a non-COVID emergency, typically businesses are given 30 days to correct violations. The second step was to issue a closure notice, which were typically for repeat violators. This step required the business to remain closed for up to 2 weeks or until the next tier, so it could have been substantial. And then the last step was to issue a closure notice along with a fine. And the fines were up to $1,000 per day per violation, so they could add up very quickly. Fortunately, we only ever needed to use notices of violation and facility closures to gain compliance. As I said earlier, progressive enforcement is designed to encourage businesses to comply and not to move to the next step, which was largely successful. Next slide, please. The Environmental Health Branch performed around 8,200 compliance inspections, and we issued citations to around 2,200 businesses, which was a violation rate of roughly about 27% of those inspected. So there was a fairly high rate of businesses complying with the health orders, or about 75% of those inspected. You can see listed there some of the most common violations, and historically we were issuing 0 to 3 closure notices to businesses each week. And again, those were for repeat violators, those that were not coming into compliance. It's also worth pointing out that many of those inspections were the result of 311 complaints. And we had set up a special COVID box with the 311 center, and we responded to around 3,000 or more complaints, 311 complaints during our pandemic response. In closing, from time to time, I get asked about San Francisco and how we were able to achieve such great COVID statistics. And we were held up nationally as an example of a large city that had done it right. And I think there are a variety of factors that contributed to those results, including a massive or Herculean effort by my colleagues throughout the department. But one of those factors was the tremendous amount of time and effort that went into that ounce of prevention I spoke about earlier. The open channels of communication between local government, us here at Environmental Health, and the business community, I think, was outstanding. And from the beginning, we recognized that there was going to be a limit to the amount of compliance we would achieve through enforcement alone. And that long-term compliance with the health orders was only going to happen when we had buy-in from the business community and by forming a partnership, which is ultimately what I think we were successful at doing. So that is a quick overview of the environmental health branch's role during the COVID emergency. I'm not saying that the emergency is over yet, and we are continuing to monitor the current increase in cases very closely and recognize that there's a surge right now. We may be called back into to enforcing health orders again, and we're prepared to do so. I'm now going to turn it over to the Environmental Health Branch program I mentioned we were going to highlight this afternoon, and that's the Children's Environmental Health Program for their presentation. Next slide, please.
Good afternoon, commissioners, and thank you again for the opportunity to present here today. I am Jonathan Piakis. I'm a senior industrial hygienist and supervisor of the Children's Environmental Health Promotion Program. We're going to focus mostly today on the childhood-led prevention portion of our program, but I do want to mention that the Children's Environmental Health Promotion Program as a whole involves a number of other duties and activities that truly touch and improve the lives of so many children and their families across all of San Francisco. The success of this program over the nearly 30 years it has been in existence can be attributed to just one thing, and that's the absolutely amazing staff working in the program. You're going to hear a little more from two of those wonderful people, Haroon Ahmad and Karen Yu, today, but I also want to acknowledge the other absolute rock stars that are currently involved in the program. Janelle Lee, Sherry Valdez, Sarah Saavedra, David Lowe, and Cynthia Melgoza. Not only do they make my job much easier, they exhibit a sincere passion, care, and dedication in their work, which is felt by the clients we serve on a daily basis. So with that, I want to thank you again for your time today, and I'm going to go ahead and turn it over to our health program coordinator, Haroon Ahmad, who will go into a little more detail about the services we provide. Take it away, Haroon.
Thank you, Jonathan. Good afternoon. My name is Haroon Ahmad, and I am the LED Program Coordinator for Children's Environmental Health Promotion Program. I have been in this placement since 2016. However, my affiliation with the program goes all the way back to the first day of the program back in 1993, when I was among the very first few staff who joined the program. And I just keep circling back to this program. It's a wonderful program to keep coming back to. Next slide, please. So our mission is to promote healthy home, childcare, and school settings so that children can develop to their full potential. We help families by linking them to needed services or code enforcement. We provide information, education, and training to community agencies, medical providers, and interested groups in support of these goals. At the heart of our core values is our commitment to ensuring the health and well-being of the whole child. Our diverse partnerships are very valuable in staying true to our core values. Next slide, please. So just to give a little bit of understanding how we are situated, like Patrick said before, we are part of environmental health. Children's Environmental Health Promotion Program is the overall umbrella, and then there are multiple components under that umbrella. And the core of the Children's Environmental Health Promotion Program is the childhood-led prevention program that I belong to. But we also have a lead settlement project that's just starting. We have asthma home visiting program for children and adult, a small component, but it's very effective. We also have comprehensive home environmental assessment services, and we have on the side family housing and security work group. So all of these components have a lot of collaboration going on, and our success is the result of all that collaboration. Next slide, please. So whether it's our work in lead or the litigation or the housing insecurity or asthma home visiting or comprehensive environmental home inspections, there's a lot of collaboration between the public at large and the medical facilities and the health department and other city departments that, again, all feed into the success of this program. Next slide. Our key functions, and again, I'm gonna talk mainly about lead, but they also overflow to other programs. But for lead, we pretty much do intake of lead cases in San Francisco. These are cases of young children who have been exposed to lead in their living environments. And then we triage them for proper medical and environmental follow-up. And our medical follow-up pretty much entails assigning a public health nurse to work with the family to ensure that the child is getting proper testing as required by the state, and also linking that child with other programs that can be helpful. On the environmental side, we have a code enforcement program where our senior environmental investigators go in and they do environmental investigations. If they find something, they issue notices of violations, and then they make sure that everything on the property gets rectified and we achieve clearance on that property before we clear it for good. And we also have an education component to our lead world, which is pretty much educating the medical providers on one hand, because they do need continuous guidance from state, and also the updates that come from state, as well as public at large. So we have health educators on our team that go out, they hold health fairs, they visit childcare centers, they make presentations in public. And on the other side, we have our nurse, Janelle Lee, who goes in and she does presentations to the medical providers and tries to bridge that information gap. And in the end, the collaboration just continues happening, and we collect the data that we collect, we analyze it in order to do program planning. And also, like Jonathan mentioned, that we are a state entity in the sense that we are funded by the state of California. So we also have to provide our regular reports back to the state of California. And we also do a lot of data analysis in order to answer any questions that come up locally for us. Next slide, please. So just a little bit about lead. Right now, there's no safe level of lead in a human body. CDC has been revising their level of concern over time. Back in the 60s, it was as high as 60 micrograms per deciliter. As of 2012, it's at 5 micrograms per deciliter. And that's in documentation. CDC, after 2012, CDC has been making verbal statements that human body has no purpose for lead. And lead, it's a pretty nasty thing. It affects almost every organ of the body. It also has the capacity to cross the placenta barrier and enter the child even before the child is born. So that's why in San Francisco, we don't wait for children to become lead poisoned before we get into action. Any public who has a young child under the age of 6 can pick up the phone and give us a call, and we will go out and we will investigate. Next slide, please. A little bit about the San Francisco story. San Francisco is an older city, has ample supply of older homes built prior to 1979. In fact, 84% of housing stock is prior to 1979. 1978 being the year when federal government took lead out of interior paint only. Commercial use of lead still continues. Exterior paint still has it. And what happens is that over time, paint starts to flake and chip, and alligator starts producing lead dust, which is almost invisible. So really, housekeeping is not that much an issue. We do not see it, we do not clean it. Children are more prone to lead poisoning because their bodies have a higher rate of absorption for lead compared to adults. And also the bodies are in that initial growth phase where the bodies really cannot differentiate between lead, iron, calcium, and vitamin C. So anytime lead goes in, the body treats it as one of those other wonderful minerals and sends a message to itself to start storing it in the bones, fatty tissue, and the bloodstream. So what we did was, after we looked at where the older homes were in the city, we also took our violations, property violations, and we threw them on the map, as well as our concentrations of blood leads, children actually testing for blood lead, and we threw that data on the map. And as we can see, the blue rounds and the green squares, they're pretty much all over the city. So that's why our target area is pretty much the whole city. Next slide, please. And when we talk about traditional sources of lead, we all, in our data shows that most of the lead sources are in the paint in the inside of the house. And I say inside of the house because that's also where our investigation is concentrated, because we investigate areas where the child spends most time. And usually it's the indoor of the house. Sometimes it is the backyard as well, or a child care center. But again, our data shows that most of the hazards are damaged paint in the interior of the house. Paint, when it alligators, it creates dust. So our data also shows significant lead dust. Soil is also an issue. Water keeps coming up in San Francisco ever since Flint, Michigan. However, I'm very glad to report this over and over to public and all, that water is not an issue in San Francisco for lead poisoning. Our source is Hetch Hetchy, heavily controlled. And then the water that's flowing into the city is coming through pipes that PUC has been replacing for the last 20 years. And homes can still have older pipes in them. However, they're so old at this stage that I always tell people that they can think of them as an artery that minerals have coated on the interior of the pipe. So water is really not touching those pipes. We still do water testing for any child who has a blood level of 9.5 micrograms per deciliter, because that's what the state wants us to do. And we are yet to find one case where the water is above the allowed threshold of 15 parts per billion. Next slide, please. Our services, we have been, like I said, we have been in business since 1993, and this is just a capture of data since 2013. Our services did see a decline for a couple of reasons. The biggest decline that we see was during COVID, and there are a couple of reasons again for that to happen. One is that the state of California, once we went into lockdown, we were not allowed to go into people's homes. So we could not do our investigations on site. Also, there were less children accessing medical help or going out to get tested for lead. So in return, there was less data coming out of the medical providers and the labs and the state even. And that's a trend that the state has reported they are seeing with every county. But what we did was that since we couldn't go out, we switched over to something called remote environmental assessment. And we worked with the state to develop those protocols. And basically what happens during that is that we touch base with the client. We hold Zoom sessions with the client. We go room by room, surface by surface, and we try, our inspectors who have the expertise in the field, they try to their best to assess what the hazards could be. And then they deploy some sort of documentation to the client, telling them how they can control these hazards in the interim time that we were in COVID-19 lockdown. Now California has reopened and we have the green light to go out again. So we have started our investigations again as of July 1st. But what we are doing with all the remote environmental investigations that have happened in the last year or so, ever since we went into lockdown, is that we are also sending them invitations to have us come out and do a physical investigation. So this data is only through June 30th of 2021. And after that, we have started contacting, there are like 140 plus families that went through our remote environmental assessment program. So we are contacting all of them, offering them an on-site investigation. So our investigators and inspectors will be pretty busy in near future. Next slide, please. So that's the end of my part of the presentation. And now I will hand it over to Karen Yu. She's one of our senior inspectors, and she will address the lead settlement project. Thank you.
Good afternoon. I hope you can hear me. My name is Karen Yu. I'm a senior environmental health inspector with the environmental health branch. I've been doing lead work since 1990, probably, for over 30 years. So, so today I would like to introduce you to the health department's project using the lead settlement money. First of all, I want to tell you that we renamed it to call Fix Lead SF. And as you know, as you've heard, the Children's Environmental Health Promotion Program, we've been doing prevention work for the last 30 years. We educate parents, we educate the providers, property owners, and even contractors to try to prevent lead poisoning. But through Fix Lead SF, we have a great, tremendous opportunity to prevent lead poisoning by finally rooting out on a larger scale and a faster scale the lead paint and the lead contaminated soil that can contribute to most of our lead poisoning in San Francisco. And so, as you know, the settlement came through a 20-year litigation process between 10 counties and cities in California and 3 paint manufacturers. And as a result of that 20 years of work, finally, the paint company is now required to pay the state of California $35 million. And that $35 million has been divided amongst the 10 counties and cities based upon their number of pre-1950 housing. And so as a result, San Francisco will be receiving $21 million over the next 4 years for this project. And next slide, please. Next slide, please. Thank you. So as you have heard, the Children's Environmental Health Promotion Program is a very collaborative, multidisciplinary program. And this will be the same with Fix Lead SF as well. For example, the health department, we hold the expertise of many, many years of working on the lead issue and the data. So we do a lot of the pre-planning about where we're going to work in San Francisco. And we've also have a lot of experience working with families and property owners. So, but on the other hand, we're going to be relying on our partners, the San Francisco Department of Environment, because they have had lots of experience doing energy rehab programs in homes. So they're going to be managing the day-to-day lead remediation activities. But in addition, we cannot do this work without collaborating with city agency and community-based organizations who work with families and property owners. We really want to learn from them how to make this program more efficient and more cater and make it easier for them. So we'll be working with nonprofit as well as city agency on doing that. And then in addition, we'll be doing outreach through these agencies as well. And we've also been meeting with lead certified professionals to understand their needs in order to design the scope of works and the implementation procedures that would work for their small businesses and for the city as well. And finally, we're going to be working with the Mayor's Office of Economic Development to increase the number of lead certified professionals who can, on an ongoing basis, do lead safe construction work in San Francisco. Even after this project ends, we hope that these professionals will continue to do lead safe work in San Francisco. And then in terms of how we're prioritizing the spending of this funding, as Harun Ahmad has already mentioned, a lot of our work is based upon poisoned children, although we do take cases that are involve non-poisoned children, but most of our work concentrate on poisoned children and those properties that we find that have lead hazard. But with this project, we really want to go into homes without having a poisoned child already, and we want to even address those leaded components that are not yet hazardous. So for example, we want to deal with the windows in San Francisco because we know that windows, the double hung windows in San Francisco are big hazards for children. And so even when the windows are still in fairly good condition and if they have lead, we want to substitute that for a safer set of windows. And so, but of course, we will control those, we will take care of those places where there are already hazards, and we will try to remediate that as well. So in this way, we hope to reduce a substantial amount of the hazard in San Francisco. Even with this large amount of money, we had to triage, scale, and try to focus. So we're going to be concentrating on homes that were built before 1950 because we have found through experiences that homes built after 1950, they do not contain that much lead in them. And naturally, we'll be focusing on children, homes with children under the age of 6 and expecting mothers. And we have identified areas within San Francisco where there are many more low-income families. So we'll be concentrating on those areas. And those zip codes are 94110, which is the Mission in Bernal, 94112, that's the Outer Mission in the Excelsior, and 94124, which is the Bayview. And then in terms of abatement versus interim control, that means abatement is when you take the whole component out versus those that you kind of leave in place, but you identify methods through which you can reduce the exposure of children to those parts. For example, one good example is like those hutch or the built-in cabinets that we have so many of in San Francisco. Often the shelves are painted with lead, and every time you take pots and pans out of them, you're creating a friction and the lead dust will come off. And so interim control may not be to take out the whole cabinet, but to put like contact paper or aluminum over it, and so that the surface, the painted surface, will be protected. Or in windowsills, we might put what do you call the covering over the windowsill so that children cannot bite into it and get into the lead paint. So we'll be looking at all kinds of methods like that in order to reduce the lead exposure. So that's all we have today for today. If you have any questions, we'll be happy to answer them.
Commissioners, I see one person on the public comment line, so I'd like, if it's okay, I'll check. First on the line, if you'd like to make public comment on this item, please press *3 to raise your hand, and we will recognize you to make public comment. *3. All right, I don't see any hands, commissioners.
Okay, I do have a couple of questions. And I want to thank you very much, the team, for answering some of the questions that I had submitted earlier. So a couple of follow-up questions that I have when on the public health nurse, that the case of a poisoned child who has tested within the level of being lead poisoned is referred to the public health nurse, who, from my understanding, does the case management follow-up. Is then, and from my understanding too, is then the public health nurse provides community resources to the family. Question 1 is, does the public health nurse follow up to see if in fact the family did receive a response from the community resource that was given to the family? Because I know that oftentimes that is problematic for a family to get a return phone call. So that's question 1. Question 2, does the public health nurse on a regular basis, especially for the age 4, 5, and 6 children, collaborate with the San Francisco Unified School District to alert them of these children who may need early testing through the IEP process within the school district? And again, that's part of what I look at as prevention.
Presenters, anyone respond to the commissioner's question?
Yeah, hi, this is Haroon. So question 1, the relationship of a public health nurse with the family. When a child becomes a state case and we are under a state contract, the state actually identifies or defines a child all the way up to age 21. So the child stays with us till age 21. However, what happens is as the child starts growing up, because majority of our cases in San Francisco are in toddlers or under the age of 2. And the reason for that is that one, like I said, the bodies are very new, human bodies are very new. So they have a high rate of absorption for lead. They also have that whole thing about distinguishing between lead, iron, calcium, and vitamin C. And as time passes, our bodies become naturally good at excreting lead also. So bulk of our caseload is ages 1 and 2. We hardly see anybody, a teenager, for example. Or there's a very small proportion of cases in the later ages, 4, 5, and 6 also. And the same reason goes there, because also the child behavior changes. Initial years have a lot of hand-to-mouth activity, where the children are exploring this world with their hand and mouth. As they grow up, they tend to grow out of that. So public health nurse, again, stays with the family for the duration of the time it's going to take for that lead level to drop below the acceptable level, where we can say, okay, now we are in the green and we can close the case. And there's regular correspondence with the family. There are regular checkups with the family. They do a lot of phone calling. Their visits, intermittent visits. If they suspect that things are not progressing the right way, they go out back in the field. Not just a public health nurse, but she also then starts taking the environmental investigators in the field with her, because just in case they miss something or a new source of lead has come up within the family. And it's a comprehensive approach. So they do make those connections with other programs, and then they do check on that too, to see if the family was able to make those connections or not. And sometimes if the family is failing at that, the nurse will take it upon her to make those referrals. So that is the relationship of the nurse with the family. Secondly, about notifying San Francisco School District about children with elevated blood leads, we do not notify ages 4, 5, or 6. We just notify. It's a provider, patient, and health department kind of collaboration that is happening there. Unified School District, parents are welcome to identify or notify Unified School District, and if with their consent, if they approach us, then we can say something to them too.
Okay, to follow up, I guess I'm asking so many questions because I've worked with many kids who have been exposed to lead. And so my concern is the education to the parent to help them advocate for their child through the school district if in fact there are cognitive issues that were impacted by a long exposure to lead, in just giving parents that information that there could be the cognitive concerns, and if so, with the school district, this is what you do. That's what I'm asking. Are we providing that kind of information?
Not per se. Yes, we are managing the child with the medical provider and the family. And that connection with the school district, it's not totally there, I would say, at this stage. And also, but it's a very good point. I think it's worth us taking it back to our contract overseer, the state, because our work plan gets developed at that stage, at that level, and then it comes down to us. So I mean, I agree. I'll have my public health nurse follow up on that with the state.
Okay, I'd appreciate that, and maybe just to then let this committee know what the follow-up might be. Again, since we're looking at the lead settlement dollars, if there were, you know, other written material in multiple languages that could be given to parents on how to access the school district, I would recommend that that just be included in the information provided to parents.
Sure.
And
I just, yeah,
if I may jump in, I'm the conduit by which you all can notify the committee of any changes or any future responses to these questions. So please, please forward info to me on behalf of the committee.
okay, thank you. I have one more question in the presentation on the lead abatement projects. Who's paying for that?
Yes, this is, oh, go ahead, Karen.
Oh, I was trying to unmute myself. The paint company is giving the money to Santa Clara County, and Santa Clara County is funneling the money to each one of the counties. So basically, the money belongs to the city, but is held in the Department of Public Health account. So the Department of Public Health, the city will be paying for it. So basically.
So if an apartment that was built in 1936 and it still has lead paint in a number of rooms, and they've been cited and it has to be removed, etc. Who's responsible for payment of repainting the place and scraping down the paint or whatever is needed?
Usually before we have had this money, like currently, the owner pays for that remediation.
Okay.
And when the program starts, we will be inviting all the property owners who get a notice of violation from us, and all the owners who do not get a notice violation from us, to apply to this program. And if they choose to apply for this program, then the city will pay for it.
I see. Okay. Thank you.
And Commissioner Gerardo, Commissioner Christian has her hand up.
Please.
Thank you, Commissioner. And thank you for that line of questioning. It's really useful and interesting. And thank you to the presenters. During the first part of it, a question came into my mind regarding whether people who are pregnant are being tested. And so I was very happy to hear in the fixed lead portion of it that people who are expecting children are prioritized. And so I have two questions about that. I'm wondering how the outreach works to people who are pregnant, and also, are you including people who are, for whatever reasons, expecting children to come live into their home in that outreach and that prioritization, you know, whether it's through adoption or through family members bringing in children who are relatives who to live with them when their parents are not able to raise them. So for those two questions, I'm interested in.
Yes, those are extremely good points. Yeah, so our LED program has been in existence for over 30 years. So we have an extensive network for outreach, including pregnant women. For example, we have done many projects with the WIC program in the health department, and they also have many contacts with pregnant women. And we've also done outreach with like the birth certificate department. So yes, we have an extensive outreach, and we will be using most of that for our lead settlement project, those channels as well. And the question about whether, like for example, grandma who takes care of the children 3 or 4 times a week. Yes, we will be considering those children visiting, and they will be included in the eligibility for applying for fixed LED SF.
And how would the outreach work for as you said, for grandma in that situation? How would that kind of issue be flagged for them?
Oh, the message will be there that it is children, and even children who spend so many hours, we decide 6 hours a week there. That will be included in all of our outreach messages.
How does that information go out? Like, what are the channels that you reach out to people?
Okay, so every day they're new, right? So we have all these agencies that we work with. So we usually make presentations, or we have brochures. And so in addition, now we have a web page that we're going to be building. Not that everybody looks at a web page, but we still do a lot by word of mouth and people who work with these families. Like the Children's Council, they work with a lot of families and child care centers who will be reaching through them as well. And we have done even things like bus placards, and we just have done a variety of outreach methods like that. But mainly we go out to a lot of agencies and we talk to a lot of people and try to get into their meetings and all of that. Yeah.
That's great. Thank you. I wonder if there is some of those agencies or offices include agencies that work with the LGBTQ community, people who might be perhaps adopting at a higher level or not necessarily being focused on in the way that through these more traditional channels.
I'm not sure, but yes, we can certainly take a look at that. I'm not sure that has been an avenue, but we'll certainly look at those agencies as well. Adoption agencies, correct?
Yeah, or adoption agencies or community centers, places where LGBTQ people may go for information, for assistance, or for community generally.
All right, I'm writing it down.
Yeah, this is Jonathan. I think that's a great point. And I think we're lucky to be here at this time when we're in the early stages of program development, where we can make those changes and make sure we touch all the different corners of San Francisco that would be eligible for the program. So yeah, I think that's a great recommendation and something we'll definitely take into account and report back on as well through Mark as well. Thank you for that. Appreciate it.
Well, thank you so much for being responsive and also for the work. It's so important to prevent the harm that damages people's lives, as we all know.
Absolutely.
Commissioner Christian, I would also add to the resources that you're requesting is for the outreach to the family qualified health centers, the FHQCs in the city. The family centers, I think we have 27 of them for families in all neighborhoods, and I think they would be an excellent outreach, and to be able to, with this lead settlement money, it would be a very easy outreach. And I would suggest to make things streamlined and easy for you. If you talk to and communicate with First Five San Francisco, they're the group that is in charge of the family health centers.
Oh, yes, First Five is definitely included in our list. Yes,
Okay, yeah, and along with that though, the family
yes.
health centers.
Thank you.
You're welcome.
And if I may jump in, DPH folks, thanks again for this great presentation and the information. You might check with the CHEP folks, the Community Health Equity and Promotion folks, about Commissioner Christian's suggestion around the LGBTQ folks, because they definitely would have those avenues already established so that you wouldn't have to recreate the wheel, so to speak.
Absolutely. Yeah, we're in very close communication with them on a number of different things. So we'll definitely check in with them as well. Thank you.
Any other questions or comments, commissioners, before we move on? Okay. Thank you again, presenters, for your great work. Item 4 is emerging issues. Commissioners? Or anyone in the public, if you'd like to make, there's going to be 2 opportunities. You have an opportunity right now to bring up a topic for a future meeting for emerging issues, and then the next item is going to be public comment, which is general public comment, which is an opportunity for the public to make a comment about something that's not on the agenda. So please press *3 if you'd like to raise your hand for emerging issues. *3. Oh, okay, great. We've got a hand. Just for you to know, folks, I'm going to read a statement. For each agenda item, members of the public have an opportunity to make comment for up to 2 minutes. The public comment process is designed to invite input and feedback from individuals in the community. However, the process does not allow questions to be answered in the meeting or for members of the public to engage in back and forth conversation with the commissioners. The commissioners do consider comments from members of the public when discussing an item and making requests to DPH. Please note that each individual is allowed 1 opportunity to speak per agenda item. Individuals may not return more than once to read statements from other individuals. All right, so person, I'm going to unmute you, and then you're going to have, I'll give you 2 minutes on the clock for you to make your comment. Caller, please let us know that you're there.
Hi, this is Cesar Espinoza Perez. Can you hear me?
Yes, please go on. You got 2 minutes.
Yes. I'm calling because I'm thankful that San Francisco, we're doing very well with COVID. However, so many more of our residents have died from overdose deaths here in San Francisco, and I don't think the response from any of the departments or any commission has really. I don't see the urgency at this point, and I would love this to be a future topic for the commission, especially because right now we have an opportunity to save lives, and I appreciate the work that's happening now. But also, it's been very challenging just to even have a meeting with the commission, or even DPH, about policy and harm reduction. And I know that there has been resolutions passed previously about harm reduction, but I don't see harm reduction actually being the policy of the city yet. And I mean this in terms of the decriminalization of drugs. And that's not harm reduction when you are coercing people to behave in a certain way. And I think this is very relevant to even the discussion today, because we are trying to prevent people from being poisoned, from overdose, from dying, you know. And so I would love to see these meetings be more accessible. I'm glad I made it here, you know, but I'm the only participant. The attendee. And thank you.
Thank you very much for your comment. All right, commissioners, we can move on to general public comment. And this is another item in which the public can make a comment about something that's not on the agenda. Please press your hand, please press *3 if you'd like to make a comment on this item. All right, I see no hands. And so now we have a consideration for adjournment, commissioners.
I so move that we adjourn the committee meeting for July 20th.
Do we have a second, Commissioner Christian? Commissioner Christian?
Have you unmuted me?
I've unmuted you, yes.
Thank you. I'm having trouble here. Second.
Okay, great. So since there's only 2 of you, that does mean that the meeting is adjourned. Thank you all very much. And commissioners, I'll see you in an hour.
Yeah, thank you.
And thank you to the presenters. It was appreciated.
Very much appreciated. Thank